Did you know that in less than 10 months, COVID-19 has killed more people than strokes, suicides, and car crashes typically do in a full year? COVID-19 has turned the world upside down. Everything has been impacted: how we live and interact with each other, how we work and communicate, how we move around and travel. Every aspect of our lives have been affected. Although the world is in lockdown, governments, school principals, entrepreneurs, and families around the world are planning the next steps: how to safely reopen schools and businesses, how to commute and travel without transmitting the infection, and how to support those most affected by the crisis. The decisions that are made now and in the incoming months will be some of the most important made in generations. They will affect people all around the world for years to come. COVID 19 has affected almost every country in the world, some of which were already experiencing humanitarian crisis, while having their businesses shutting down, families losing loved ones every day, and students dealing with the pressure of online school, which could really take a toll on them. I personally have seen the darkness and sadness that COVID has done to some families, but having a lifelong friend lose his house, lose everything he has because his family's business went bankrupt. I couldn't imagine going through that myself, and it was very hard for me to see someone that I love dearly and see as a brother go through that. According to Yelps.com's local economic impact report, more than 97,966 businesses have permanently shut down during the pandemic. On average, small businesses have at least 10 employees, which shows that more than 979,000 workers have lost their jobs. The United States surpassed 11 million reported virus cases in the month of November 2020, with 1 million of those tallied in just last week. The daily average of new cases is up by 80% from what it was 2 weeks ago. More than 69,000 people were in American hospitals with COVID-19 on November 15th, which means on average there was an average of 1,100 deaths per day. The pandemic has caused a divide in our nation. On one side, there are the responsible citizens who follow the protocol, follow the curfew, wear their mask in public, and follow social distancing rules. On the other side, it is the complete opposite. College students are throwing parties every weekend with over 100 people in attendance. Famous celebrities, musicians, and influencers are throwing parties which show their followers that they don't care about the restrictions of COVID. People choose not to wear a mask and they simply just ignore the social distancing rules. Even though the crisis isn't over, many of us simply want to move on and have some control over our lives again, the way we used to. Guidelines have loosened up in some areas, and this is the phase of the pandemic when more people have some choices to make, says Dr. Said. For some people, that means going in the extreme other direction, blowing off social distancing and going mask free. Some mask refusers see the issue only in terms of comfort and safety, out of thoughtlessness or they don't understand that wearing a face mask can prevent the virus from spreading, not just to them, but to their family and community as well. They don't see the benefit of doing something for the greater good, even if it is inconvenient. Medical science is indisputable in advocating the wearing of face masks as is needed as a curb to stop the spread of COVID-19. Nevertheless, many people, including some state governors, refuse to act on this advice and instead argue that people should be free to choose whatever they want to do. They can either choose to wear the mask or not. Almost 40% of respondents to a recent Ohio State University survey said that they plan to gather with at least 10 people for Thanksgiving, even though in many areas this comes with the likelihood of sharing a table with an infectious person. Almost 980,000 people passed through the U.S. airport security checkpoints on November 15th, nearly quadrupling the number recorded 6 months earlier when COVID-19 was nowhere as widespread. The people are behaving this way at the most dangerous moment of the United States outbreak speaks volume about human nature. There was fear at the beginning, it was national, there was a sense of patriotism, and then it faded, says Dr. Katuria, an emergency medicine physician based in Austin. The public is tired. We went from having everyone so we can flatten the curve has been replaced with the desire to return to normal life at all.
So here would be the results to if people were to get vaccines. It would help keep you and others safe. According to Centers of Disease Control and Prevention, based on what we know about vaccines for other diseases, experts believe that getting a COVID-19 vaccine may help keep you from getting seriously ill, even if you do get COVID-19. So if you do get the vaccine, like let's go back to my flu shot in example. So even if you do get the flu, it fights it off faster and it recognizes the germ. Same thing with COVID-19 vaccine. If you get the vaccine, it can help minimize the severity of the disease when you do get it, or if you ever do get it. And also, so a lot of different, it's a hit or miss with the COVID-19 disease. You either get seriously ill and hospitalized and ventilated and like on a ventilator, or you don't have any symptoms at all and you just have the disease or have the virus. But what the vaccine does is it helps minimize all the symptoms, so you can potentially not have to go to the hospital and be on a ventilator if you get the COVID vaccine for this virus. And it also will help the people around you. So let's say you go to, or like you go to your neighbor's house for a barbecue, and if you have the vaccine and they have the vaccine, you're protecting yourself. Or let's say they don't have the vaccine and they have the coronavirus and you have the vaccine, you're protecting yourself again. Same thing vice versa. If you have the vaccine and you actually do have the disease, you're protecting them because you're not as severe and you're protecting them from getting it. So in conclusion, many people are dying every day because of this virus, and it is causing a lot of people to go into very different emotional states because we are all home, we're in this pandemic all together. So now is the time to come together and help protect ourselves and others. So what do we need to do that? We need to stay safe and protect ourselves. By getting the vaccine, it will protect ourselves and others around us. Together, we can help end COVID-19. Okay, so now that you guys know about the problems of COVID-19 and the statistics of everything that's going on, now I'm going to talk to you about the solutions. So our solution is a COVID vaccine. So according to vaccine.gov, created by the U.S. Department of Health and Human Services, vaccines help your immune system fight infections faster and more effectively. When you get a vaccine, it sparks your immune response, helping your body fight off and remember the germ so it can attack it if the germ ever invades again. So let's say that, so it's kind of like the flu. You know how you get the vaccine for the flu and your body knows how to fight it off. So if you get it, it fights it off really fast and you get better faster. It's the same thing like that with the COVID vaccine. So if you get the vaccine, your body will remember that germ and it will fight it off faster, and it can help get less people sick. Even though vaccines are an obvious solution to this, a lot of people object to it. People say that vaccines make you sick. This all started in the 1800s. So according to Understanding Oppositions of Vaccines, written by Amy Belanger, she said refusing vaccines started back in the early 1800s when the smallpox vaccine started being used in large numbers. The idea of injecting someone with a part of cowpox blister to protect them from smallpox faced a lot of criticism. So obviously, that thought of someone injecting you with something that came from a cowpox blister, that idea of somebody injecting that into you is not a good idea, like, to anybody who doesn't really understand it. They're just like, okay, you're putting this thing into my body and it's supposed to make me better. Like, how does that even work? Aren't you just giving me the infection? So a lot of people got really scared. Also, a lot of people believe that vaccines cause autism. There is a chemical in some vaccines called thimerosal. And it contains mercury, and it's found in a lot of children vaccines. However, this is not dangerous and is not causing autism. According to Centers of Disease Control and Prevention, a 2004 scientific review by the IOM concluded that the evidence favors rejection of a causal relationship between thimerosal containing vaccines and autism. So, studies have shown they tested many different ways to figure out if the rumors are true, if it does cause autism, and it does not. There is no evidence supporting that these vaccines and that chemical is causing people to have autism. So here would be the results to if people were